You know, it's fascinating how much we talk about health and wellness, yet when it comes to vaginal health, discussions can feel a bit taboo, right? But let's face it, the vagina is an incredible organ, responsible for so many vital functions in our lives, from menstruation to childbirth, and even our sexual experiences. Yet, like any part of our body, it can face its share of abnormalities. So today, let's break it down and talk about some common vaginal issues that many women experience, because understanding these can really empower us to take charge of our health. Let's start with vaginal infections. They're super common and can take many forms. The big three to know about are bacterial vaginosis, yeast infections, and trichomoniasis. Bacterial vaginosis, or BV for short, happens when there's an imbalance of bacteria in the vagina. You might notice some unusual discharge that has a fishy odor, along with itching or irritation. It's important to know that while BV isn't classified as a sexually transmitted infection, it can still increase your risk of getting STIs or having complications during pregnancy if left untreated. So, if you're experiencing these symptoms, don't hesitate to check in with your healthcare provider. Then we have yeast infections, which are caused by an overgrowth of the Candida fungus. You'll know it's a yeast infection if you see thick, white discharge that looks a bit like cottage cheese, along with some serious itching and redness. These infections can pop up due to various factors, like taking antibiotics or hormonal changes, but they're not necessarily linked to sexual activity. Lifestyle factors like stress and a weakened immune system can also play a role. If you find yourself dealing with frequent yeast infections, it might be worth discussing with your doctor to find a solution that works for you. Next on the list is trichomoniasis, which is a sexually transmitted infection caused by a parasite. The symptoms often include a frothy, greenish-yellow discharge, a strong odor, and discomfort. The good news is that it's usually treatable with antibiotics, but it's crucial to ensure that any sexual partners are tested and treated as well to avoid reinfection. Now, let's talk about vaginal discharge. This is a normal part of being female, but changes in its color, consistency, or odor can indicate something's off. For example, yellow or green discharge can signal an infection, especially if it has an unpleasant smell or is accompanied by pain. Brown or pink discharge might occur after your period, but if it's persistent or outside your normal cycle, it's worth getting checked out, as it can sometimes indicate more serious conditions. And while watery or thin discharge can be perfectly normal, it can also be a sign of bacterial vaginosis or an STI, so don't hesitate to consult with your doctor if you're unsure. Another important topic is vaginal atrophy, or what some call genitourinary syndrome of menopause. This condition occurs when estrogen levels drop, typically during menopause. Women might experience dryness, burning, itching, and pain during intercourse. Research shows that a significant number of postmenopausal women deal with this, impacting their quality of life. Treatments like hormone replacement therapy or localized estrogen can really help alleviate these symptoms. So if you're experiencing this, it's definitely worth discussing with your healthcare provider. Now, let's shift gears and talk about pelvic inflammatory disease, or PID. This is an infection of the reproductive organs that often stems from untreated STIs, like chlamydia or gonorrhea. PID can lead to severe complications, including infertility and chronic pelvic pain. Common symptoms include lower abdominal pain, abnormal discharge, and fever. The key takeaway here is that early treatment of STIs can significantly reduce the risk of developing PID, so don't ignore those signs. And then there's vaginal prolapse, which occurs when pelvic organs drop or shift out of place due to weakened pelvic floor muscles. This can lead to a feeling of heaviness in the vagina, urinary incontinence, and discomfort. It's more common after childbirth, especially for women who've had multiple vaginal deliveries or are older. Strengthening those pelvic floor muscles through exercises like Kegels can be incredibly beneficial. And in more severe cases, surgical options are available. Let's not forget about dyspareunia, which is just a fancy term for painful intercourse. This can affect women of all ages and can stem from various causes, including vaginal dryness, infections, or even psychological factors like anxiety or past trauma. The good news is that it can often be treated with a combination of medical interventions and counseling. So if this is something you're dealing with, know that you're not alone and help is available. Lastly, we have vaginal lumps or bumps, which can be caused by cysts, warts, or infections. One common type is Bartholin's cyst, which occurs when the glands near the vaginal opening become blocked. While these are usually painless, larger cysts can cause discomfort and may need medical attention. And while it's rare, let's briefly touch on vaginal cancer, which is most common in postmenopausal women. Symptoms can include abnormal bleeding, pelvic pain, or changes in discharge. Regular gynecological exams are crucial because early detection can significantly increase the chances of successful treatment. In conclusion, our vaginal health is a vital part of our overall well-being, and understanding the common abnormalities that can occur is essential for prevention and timely treatment. Whether it's a minor infection or something more serious, reaching out to a healthcare provider at the first signs of abnormal symptoms is key. Remember, knowledge is power, and being informed allows us to lead healthier, more confident lives. Don't shy away from these conversations. They're important, and you deserve to feel your best.